Well, we are back coming up on 8:15 now with Your Health and a new reason to make sure that you are getting a good night's rest.
Yes, the American Heart Association now considers healthy sleep patterns key to heart and brain health. And so it's now added sleep to its cardiovascular health checklist.
When the association evaluated tens of thousands of Americans using that new criteria, it came back with a concerning number. There it is right there on your screen. 80% of people in this country have low to moderate cardiovascular health, with scores that vary significantly according to age, gender, race, other factors as well. Here to help us break it all down, Dr. Jennifer Haith, cardiologist at Columbia University Irving Medical Center. Dr. Haith, good morning to you. You would be hard-pressed to find a more sleep-deprived group of people.
I'm sure.
Probably in here in one day. So let's start with just how many hours should we be getting every night? Clear up the confusion.
So the American Heart Association has added sleep and is saying that 7 to 9 hours for adults is crucial to your heart health and your overall well-being.
What's the connection between sleep and heart health and brain health? Because it may not be immediately apparent to folks.
It's a great question, and I don't think we fully understand sleep. It's a strange phenomenon if you think about it, but we think it's restorative. We know that when you're asleep, your heart rate slows down, your blood pressure comes down, and that's a large chunk of time for your body to be in a relaxation mode, and the effects are great on high blood pressure, diabetes, obesity.
I want to go back to that full screen that we just put up just a moment ago, because it looks like it also varies by age as well, the amount of sleep that we should be getting. So you're saying that we should be getting between 7 and 9. What about folks who are younger? What about folks who may be a bit older as well?
So we know that younger children need a lot of sleep, and it's really important for their brain development. So for children under the age of 5, we're recommending somewhere between 10 and 16 hours of sleep, a day. For kids that are aged,
amazing. Kids slept, especially on Saturday.
Exactly. Adolescents, a little bit older, 6 to 12, they're recommending about 9 to 12 hours, and then older children, teenagers, 8 to 10. So it gets less as you get older, but it's crucial for young children to get good
What about those folks, and we all know them? They're like, I only need 5 hours of sleep. I only need 4 or 6. Okay, fine. They feel all right. Are they affecting their heart health?
That's a great question. It's hard to know. It's for sure true that some people seem to need less sleep and seem to function okay. But I think that the vast majority of people need a solid 7 to 9 hours if they can a night. And if they can't, then make up for it in naps.
Yeah.
So sleep is the newest addition to this checklist, this cardiovascular checklist. What else is on the list?
So the list is comprised of things that, are modifiable and less modifiable and need medication. So, for instance, nicotine, that's actually been changed this year to include non-regular cigarettes, e-cigarettes, and vaping. Sleep, as we mentioned, diet, exercise, and then hypertension, diabetes, high cholesterol, and obesity.
So if you're in that low list, you said some things you can change, some things you can't. They're your physiology. What is your recommendation if somebody comes in and says, I'm worried that my heart health is not where it needs to be?
Well, the good news is, and I take care of people with very advanced heart disease, there's always something you can do. You need to see your doctor once a year and be screened for all of your risk factors. You need to take prescribed medication that your doctors give you for hypertension, diabetes. You need to get exercising, and that doesn't mean you have to go into some psychotic fitness program. You can just put on sneakers and walk.
I know quit smoking is always at the top of the list. It's so hard for folks, and especially people who've smoked for a long time and might think, what's the point now? It's too late. The damage is done.
It's never too late. The benefits of quitting smoking can be seen at any time in life, and it improves with every year you quit. I mean, I will see patients who quit. Their skin, their hair, their physique, everything changes.
Dr. Haith, really quickly, why now? I mean, we've known for years that, more sleep is good for us. Why do they just decide to add it to the checklist now?
I think that we've realized as a community of doctors and scientists that it's really important to have relaxation as part of your overall wellness. And that's becoming something that we're studying more. And so I think it's really great that they've included it.
All right.
And I love that you're pro-nap.
Yeah.
I believe in the nap.
I love a nap.
Yes, the nap is good.
I want you to come to my house later and talk to my kids about the importance of sleeping 16 hours
I know.
Yeah, exactly.
I mean, 100%. Let's get that going. Let's check in with Al. He's on the road. He's the Energizer Bunny. How many hours of sleep do you think you get every night, Al?
I get about 6, which I know isn't enough, but on the weekends it's more like 8. Yeah.
Plus, you're not
doctor,
human.
does it have to be consecutive? Does it have to be consecutive?
Did you hear what he said? Does it have to be consecutive hours of sleep?
I mean, they're trying to recommend that people get some sort of consistent length, but like I said, LeBron is a big fan of the nap.
Okay, good. Grab it where you can. Be like LeBron, Al.
All right, we should all be like LeBron.
Hey, thanks for watching our YouTube channel. Find your favorite recipes, celebrity interviews, uplifting stories, shop our favorite deals, and so much more with the Today app. Download it now.